Welcome to Think Like a Nurse 2. Today we're going to be talking about the respiratory system. And before we actually start talking about the disorders, which will be a few segments down the road, we're going to start talking about just the basis of what the respiratory system entails. We have our mouth and our nose, which we breathe air in. And that's your atmospheric air. It contains oxygen. It can contain other particulates and possibly other toxins. But what we're most concerned about with the intake is the oxygen that we're going to be breathing in, and how the air that we breathe in is going to be, an exchange process is going to be done, so that way the body can receive the oxygen and nutrients that it needs. First of all, let's go ahead and talk about the structure of the airway. Okay, we talked about the nose and the mouth and how we take in air. As we've learned already, we understand that babies or neonates are what we call obligatory nasal breathers, and that means that they can only take in air through their nose, so they're not breathing in air through their mouth. But what our general focus here is today is going to be on the adult respiratory system. So when we take in air, we have a mechanism called the epiglottis. That is, when we breathe in, that mechanism relaxes, so therefore the airway can be opened. Our airway leads down into our trachea, and that's in this area. It's made of what we call a cricoid cartilage. And that is a tissue, a cartilage tissue that helps to protect that airway. It is also lubricated with mucus and with other glands and cells there that keep that area moist. Next, we're moving on down from our trachea area, and we're moving on into our bronchus, which leads to your lungs. We've got the bronchus is the large tree and trunk, and then we've got your bronchioles, and it looks like the upside down tree that are coming through your lung fields, and those help to spread air into each of your lungs. Remember that when we're looking at a client, we're actually referring to that client as they're lying in bed. So we're going to be in reference to everything regarding the client. So the right lung, as we remember, the right lung has 3 lobes, 1, 2, 3, just as a review, and the left lung has 2 lobes. The rationale for that is because the heart, or the cardiac chamber, here, there's an arch in the lung on the left side, so that way the heart has a place to lie. Therefore, we have, again, right lung has 3 lobes and our left lung has 2. We talked about our bronchus, which is our main entrance way into the lung fields, and then the bronchioles, or the bronchus. The bronchus is the main branch, and then we've got our bronchioles. On our bronchioles, or within this lung tissue, we have what are called alveoli, or alveolar sacs. And these are actually where the gas exchange takes place. What's happening here at the alveoli, or within the alveoli, alveoli, is the exchange of oxygen, which is O2, oxygen, and carbon dioxide, CO2. So what we want to happen in a normally functioning set of lungs is that we want to breathe in the oxygen, and it is going to be exchanged for carbon dioxide at the alveolar level. And then what's going to happen in normal lungs is that gas exchange is going to take place, and then the client is going to breathe off the CO2, or the carbon dioxide. So within that gas exchange, that is how the normal respiratory system should function. However, what we are going to be looking at is going to be respiratory disorders. So Hopefully everyone understands the actual principle behind the lungs, what happens there. We understand that we've got a rib cage that's made up of bone and cartilaginous tissue that help protect these lungs. And when we start understanding our disorders, then we're going to understand the layers surrounding the lungs, and we'll go more into detail about that in a later segment. Thank you so much for joining me as we review our respiratory system.